Բարև ձեզ սիրելի հայրենակիցներ, մենք այսօր ունենք Hospice of Grace շոուն եւ մենք ունենք մեր մեջ շատ կարևոր մի հյուր, որին պետք է ներկայացնեմ մի քանի րոպեից, բայց մինչև նրան ներկայացնելը ես կուզեի խնդրեի, որ դուք զանգահարեիք ձեր բոլոր բարեկամներին, ձեր բոլոր ընկերներին, որովհետև մենք ունենք շատ կարևոր հայտարարություններ, որ կուզենք փոխանցենք ձեզ եւ կուզենք, որ բոլոր մարդիկ տեղեկացվեն, ինչպես որ գիտեք, Hospice of Grace-ի շոուերը մենք որ անում ենք այստեղ, բոլորը մեր նպատակը, որ մենք տեղեկացնենք մարդկանց ամենակարևոր փոփոխությունները եւ նորությունները առողջապահության մեջ։ Այսօր իմ հյուրն է շատ կարևոր մի անձ, ինչպես որ ասեցի ձեզ, պարոն Rocky Delgadillo։ Պարոն Rocky Delgadillon այսօր ներկայացնում է Los Angeles County Medical Association-ը, այսինքն Los Angeles-ի տարածքի բժշկական խումբի ներկայացուցիչ, CEO, Chief Executive Officer։ Եվ նա ունի 20 տարվա experience litigation-ի մեջ, նա եղել է փաստաբան, եւ ես կուզեի հիմա նրան ներկայացնել։ Hi Rocky, how are you?
I'm happy to be here, Arpi.
Thank you. I'm very honored to have you on my show. And like I said, before the show, I spoke with a lot of the community people and everyone, and I was telling them you're going to be our show, and everybody's very excited to meet with you.
Yeah, great.
And as you know, our TV show, our purpose is to educate our community.
Right.
And my experience being in healthcare for 17 years, being in managed care, I work very closely with physicians, and I also work very closely with the community.
Right.
So my goal as a healthcare professional, I like to educate people, and I think everyone has room, even if they're doctors, they're hospital CEOs,
right.
administrators, everyone in the
Right.
healthcare field.
Right.
So I'm very honored to have you, and I know you have very good information. And this morning I was reading from yesterday, I was reading your CV, and I'm very impressed. And one thing that really touched my heart is that you work for people. You want to help people.
Right.
And to make sure that they have the best quality care. That's our mission.
That's a good mission to have.
That's a good mission to have. Rocky, I would like you to tell me a little bit about you. I know that it's your CV says most everything, but if you
Sure.
can.
I mean, I grew up here in Los Angeles, in the northeast part. I went to public school here in Los Angeles. I then got recruited to play football at that big football factory on the East Coast, Harvard University,
wow.
in the Ivy League. And then I went to law school at Columbia Law School in New York City.
Harvard.
And Harvard undergrad, right?
Yes.
And then came back, and I was a lawyer here in town for a while. And then in the early 90s, we had the civil unrest.
Yes.
And I went to work for an organization called Rebuild LA right after that event occurred. And that led to a career in public life. So I became the deputy mayor for the city of Los Angeles, and then I ran for Los Angeles city attorney and was fortunate enough to win and serve 2 terms as the city's chief lawyer and chief prosecutor.
Wow, great. Today I know we wanted to talk about MICRA. Medical Injury Compensation Reform Act.
Right.
Again, from my experience, I work with physicians. I used to do credentialing. I understand about the malpractice insurance
Sure.
and how expensive that can be, and all the lawsuits going on. So can you tell us a little bit more about MICRA and liability reform law?
Well, MICRA has been around since 1975. In fact, it was signed into law by then Governor Jerry Brown. So he's the governor again, but 40 years ago, in 1975, MICRA was enacted. And what it did was to give the healthcare community a sense of certainty about what the liability would be with respect to medical malpractice claims. Now, for economic damages, you got what you deserve. So the court could still award you whatever harm was done to you economically, you would be awarded that. The one issue that was capped under MICRA is pain and suffering, so the non-economic damages. So it's now capped at $250,000 per patient. So what's happening now is that there is an initiative that's about ready to be qualified for the ballot, that will probably be on the ballot in November, that is intending to reform MICRA. However, the campaign to reform MICRA is cloaked in a different issue. they're really talking about drug testing physicians, right?
Yeah,
and that's a serious issue. It's sort of treating physicians like, I guess, Major League Baseball players, or I don't know what they're doing there. But and then at the end of the initiative, it says, oh, and by the way, we want to raise the cap on the non-economic damages to $1.2 million. Now, certainly all of us would agree that people who have suffered harm from medical malpractice should be compensated.
Yes.
But there needs to be limits. And one of the things that the chief legislative analyst's office in the state of California has said about this initiative is that it would cost the state about $7.9 billion if this passed. And that would just be passed on to the consumer. So healthcare would become more expensive. In addition, the medical malpractice rates for physicians will probably skyrocket. So for example, today a general surgeon in the county or state of California, the County of Los Angeles, state of California, pays about $30,000 to $35,000 a year for medical malpractice insurance. In states where they do not have micro protections, where they do not have the protection that California provides to the healthcare community, that amount could be as high as $190,000. So again, the cost of healthcare would increase, and it's also the group behind this initiative, I think, is being tricky in the way that they're presenting it to the public. They're saying it's about drug testing doctors, when in fact it's really about increasing the amount that lawyers can recover in medical malpractice suits. So that's what I think all voters need to be aware of. And we believe, as the physician community, and I'm a lawyer, and I understand the need to have compensation if you're bringing an action, but the truth is this is the wrong thing to do here in the state of California at this time.
Wow, it's very interesting. And as we see, like, just my experience all this time, healthcare 17 years ago and today, I see the difference, every day, every minute, healthcare is changing. Right. Starting from the malpractice, from Obamacare, from the managed care. Right. It's just unbelievable. And so to let our viewers know about this micro, and I know that the elections are coming up in November. Right. So on the ballot, what do they have to
well, we don't have a number for the initiative yet.
There's no number? Okay.
But it shortly will qualify. Everyone believes it will qualify, and we'll have a ballot number and a ballot designation and all that, and then you'll be able to know more about it. But I think it's important for the community to know that there is this initiative afoot, that it is going to try to, in their words, reform MICRA, but it will increase the cost of health care in the state of California. And the people who are putting it on the ballot aren't being genuine with the public, and they're trying to cloak it in another issue, in this case, the drug testing of doctors. And look, I believe that physicians are some of the held in the highest esteem in our community, and they should be, because they have the highest level of integrity. There might be some bad apples in there, but there are very few, like in any profession.
Of course.
But I think, from my experience, physicians handle themselves with the highest level of integrity. They do the best they can for the patients that they serve. One of the things that I've noticed about healthcare, I think, is little noticed unless you're the patient, and that is that one of the most intimate relationships of trust in our community is between the physician and the patient. Yes. They have to know that they can exchange information in a confidential way and in a way that will help improve the health prospects for that particular patient. And I see doctors go that extra mile every day to improve the healthcare outcomes for their patients. And they don't have to do that, but they do it.
I can validate on that, because working in a hospital, I've seen a young girl that came to our hospital, and she was having electrolyte deficiency, and she had no health insurance, but our doctors went above and beyond and saved her life. And today she works for my company.
Oh, wonderful.
Yes, she was code blue for,
God.
Yeah, wow. They brought her back, and they had to get a special stent for her from Canada, and she had no health insurance, so doctors went. That's why when some people, when I talk to some people and they know you're in healthcare, they always try to downgrade doctors. But I think that we should remember that these are the ones that save our lives.
Right, and one of the things I think that is really important is that, for the most part, most of the physicians that I encounter are very humble about their profession and what they do.
Yes.
And so every day, practically every day, a physician goes to work and more or less saves somebody's life.
Definitely.
Right? And in some cases, in the very severe situations, and on the verge or maybe beyond being saved, but they bring them back. And most physicians think, well, that's part of my job. And they don't go out and brag about it and tell everybody how magnificent it was that they saved somebody's life today, but they do that. That's what they do every day. And I think all of us need to be more cognizant of the contributions that physicians make to our community.
Definitely, definitely. All my respect to all the physicians. And so there is a misleading information out there. That's what our viewers have to be aware.
Right.
The ones that vote and that understand English.
Right.
And they can talk to their elderly and their in the community.
Right.
So the misleading information is that
right now, what the campaign for this particular initiative says is that, do you want to have your doctors tested randomly for drugs?
Drug testing,
for drugs.
Yes.
And by the way, we'd like to raise the cap on MICRA from $250,000 to $1.2 million. And so really that's what they're trying to achieve, and also try to bring drug testing to doctors. Both of those things will increase the cost of health care for patients here in the state of California, and already we believe that there is limited access to health care throughout our county for sure, and certainly across the state.
That's a big
so this will
Yes.
decrease access. In some states like New York, where they don't have micro protections, where there's unlimited amount of non-economic damages that can be recovered, there's 19 counties in New York, the state of New York, that do not have an OBGYN. Why? Because it's too expensive to buy medical malpractice insurance. They can't afford to do it. And so then that care is not provided to the community.
Speaking of that, when I was working on the HMO side, when we try to contract doctors and we're trying to find specialists for the group, and it's really hard sometimes to find a specific specialty. For example, OBGYN. For example, a woman OBGYN.
Right.
I think with the Armenian community, it's a cultural thing. I think same with Latinos. It's hard to find a female OBGYN.
Right.
There was like one or two that I know, or some specialties.
Right.
So what can we tell about our viewers to send the kids to school, to medical school, to become more doctors?
Please do. I mean, one of the things that is really, in my opinion, is a crisis, not only here in the county of Los Angeles, but throughout the entire state, that we have a shortage of doctors, a shortage of physicians. And part of that is because I think young people don't see it as a promising profession as they once did many years ago. And so not enough young people are going to medical school. So one of the things that we're trying to do, hopefully with this program and also as part of the LA County Medical Association, is encourage young people to go to medical school. And we're giving scholarships to kids who are in college who want to go to medical school and come from some of the more challenged communities here in the city of Los Angeles. And that's one little way, but that's a drop in the bucket. We need reform all across the board. We need more medical schools. We need more people to go to medical schools. We need the government to incentivize people to become physicians, and then we need to recruit physicians to come here. So it might mean that we have to go to foreign countries like Armenia and bring them here, or places like Mexico or Latin America or Japan or wherever else, and bring them to Los Angeles because we do not have enough doctors. One of the exacerbating factors is that the Affordable Care Act is now going to give insurance cards to about 700,000 newly insured here in the county of Los Angeles. Well, let me put that in perspective for you. 700,000 is the number of people who live and work in the city and county of San Francisco. So it's like taking the entire city of San Francisco, giving them an insurance card, they didn't have one before, and saying, now go get care. Well, currently, as you know, it's hard to find doctors, hard to get an appointment if you're a patient. Now 700,000 new patients will have an insurance card, and they're going to demand services and say, I need my health care. I paid for this card. I need my care. And they're going to have to wait, and they're going to be denied access even though they paid for insurance. So there are challenges that are at our feet at the moment, and I believe it's at a crisis level, and I hope that more people are cognizant of it, and I hope in the end more patients get care, but right now they will not.
I have one question. I work very closely with Armenia, with doctors, and 2-3 years ago, I represented Glen Memorial Hospital when was the Armenian World Medical Congress.
Oh, yes.
It was in Armenia. They do every 2 years, and it's in a different country. Right. And I met with a couple of physicians, and their question was if Armenian Medical Association or LA County Medical Association has a program for foreign students, foreign graduates to come to United States, to continue education or become doctors. Do you have that?
We do not have that program, but we would, and that would have to be run through the government because they have to get licensed, and we're in a trade association. But but it would be a great initiative for one of our legislators to put forward and have the state of California attract these physicians in from foreign lands who are some of the finest in the world and have them come to Los Angeles and practice their trade. I mean, I think that there's a real opportunity.
City of Angels.
Yes, for the City of Angels. So come spread your wings here.
Yes.
We'll put a halo on you. We do that, everybody that arrives here. So I think it's a real opportunity. There's a crisis. We have doctors from around the country. We have young people who don't know what it's like, what the issues are to become a physician, but we need to encourage more and more to go to medical school. Now, it's hard.
Yes.
You know, you got to go to undergrad 4 years, then medical school for 4 years, then a residency for up to 4 more years after that, sometimes more. But in the end, there's really no more rewarding profession. As I said, there's no more intimate relationship than between a doctor and a patient, maybe a husband and wife. But I mean, but other than that, a professional level, there's no more intimate relationship. And how rewarding it is that every day you go to work and you improve somebody's health.
Of course.
Or you save their lives.
You give someone, yes, exactly. I think a couple of months ago, or it was a year ago, there was a hospital, one of the hospitals, that they refused services to a homeless person. And I know that my parents were talking about it, and they were very much kind of disturbed. And my dad was really sad about the healthcare, and because I'm in the healthcare, so he asked me. And I couldn't answer a lot of his questions. So if you can please, what happened? Why are hospitals denying access to homeless? Or I know that most of the hospitals that I know, at least I work with, I know that if somebody walks in with no health insurance, and they first give care. But this really happened, and this was all over the news. So what happened?
Yeah, and if you might remember, I was the city attorney at the time, and they were dumping patients on Skid Row.
Yes.
Right.
Yes.
They called it homeless patient dumping, and it became a national issue. And I prosecuted hospitals for doing that exact thing. The issue is just the economic pressures. There's significant economic pressures on the hospitals and the people who work there to make sure that facility, this hospital in this case, is profitable and that can stay open. And one of the challenges with treating homeless patients, you have to treat them. You have to treat them. Is that obviously they have no ability to pay, but in the business planning, the hospitals need to plan for that. And they need to know that their stature in the community, their ability to serve those people who can pay, will be enlightened and improved if they serve those who cannot. And that's something I think that they have to, and many physicians are this way, they let go of the economic issue because they're going to care for the patient.
Exactly.
But there's so many pressures, especially from the payers, from the health plans on these hospitals to not deal with it.
I've been through that. But like you said, a lot of our physicians and even hospitals, they went above and beyond to give that person the health care.
And I think most of them are that way. There are just some aberrations, and hopefully they will end.
Well, thank you, Rocky. I mean, you did a great job. Thank you for that. And then one thing that I'm very much involved in, we've been talking about on my show about dual affiliations with Obamacare, the healthcare changing, everything becoming an HMO. And I know I work very closely with physicians, with the groups and the meetings that's going on. Everyone's nobody knows what's going to happen tomorrow. So what can you say? What is LA County Medical Association is doing about that?
Well, one of the big issues here in the County of Los Angeles and the state of California is something called the dual eligibles program, or I think the government name is now CalMedi Connect.
CalMedi Connect.
CalMedi Connect. So these are patients that are the most vulnerable in our population. They're the poorest of the poor, the disadvantaged, the elderly, the handicapped, the blind. These are the patients that we're talking about. So they're eligible for Medi-Cal and Medicare. What's happening is there's a program at the state that they call a pilot program, but they're going to deal with 200,000 patients here in the county of Los Angeles. That's not much of a pilot. And they're going to passively move them from their doctor. They're going to take them away from their doctor.
Yes.
Well, again, that most intimate relationship is between the doctor and the patient. And if you move that patient without their permission or without the doctor knowing, what's going to happen? People are going to fall through the cracks.
Exactly.
People are going to get hurt, and some people might lose their lives. So we're pressing on the state to say this is too big, too fast, too large, and don't make sure our democracy is built on choice. Make sure that that patient has an opportunity to choose who their doctor should be, and don't choose for them, and don't be so paternalistic on that in that regard.
But also patients have the right, patient have the choice to stay with their doctor, but depending what medical group their doctor will sign his or her contract.
Maybe, but what
right?
if they don't? And,
what if they don't?
There's no requirement, the physician should not be required to do that. And the other issue is that there's supposed to be an opt-out form. Well,
yes.
No one's seen it yet. And the one that we have seen, it's so complicated that no one can figure it out. So it's designed to default so that the government can switch them over, because in the end, the government will save money. And it's about money, not about patient care. And we think it should be about patient care.
But do you think that the quality of care will go down?
Well, you know, what I do think is that in that transition, patients will be hurt. So definitely quality of care will be reduced. Most of the physicians I talk to are not concerned about the managed care aspect of it. It's that the patients are being moved passively without their permission.
Without their permission.
Yeah.
But one thing that I noticed, and my goal, my vision, and I've been talking about the show, about the fact that a lot of the people, like especially the Armenians,
yes.
because this show is for Armenian community, you know, when they get their letters, they don't read. Or that's why my whole point is to educate our community, and we keep talking about these changes, what's coming up, and the bottom line is they need to understand and make the choices for themselves.
Right.
Because if they don't, somebody else will.
Right. And so what all we're saying is that make it simple. Make it very simple.
Yes.
It's so complicated that it's really not a choice. It's really any patient, like from the Armenian community, the Latino community, the Korean American community, they're going to take that. It looks so complicated. They're going to just set it aside or throw it away and then ask their doctor. And their doctor won't know because the doctor won't have it in front of them. Yes. And that shouldn't be the doctor's job anyway. It should be the government's job to make it simple for them to choose which plan they can go with.
Well, the reason that I really wanted you to be on our show is that, like, for example, to educate the community about
Yes.
what's coming up so
Right.
they understand more.
Right.
And to understand about healthcare, because I get calls, for example, somebody will come in from a hospital and say, oh, Arpi, you know, my dad is in the hospital.
Right.
They're moving my dad to a different hospital. And I'm
Right.
like, okay, who's your the father's doctor? They don't know. Who's the medical group? They don't know. Who's
Right.
the health plan?
Right.
So, and then we find out that the doctor that they sign up with is signed up with a different medical group, that the
Right.
patient has to go to someplace 40 miles away from Glendale, for example.
Yeah, exactly.
So, and then they get surprised, and that's the reason we try to educate everyone to understand, because healthcare today, it's an important issue for everybody to understand and make decisions.
And absolutely. And one of the things that I think your viewers should know is that probably the most important advocate for you in the healthcare community is your physician.
Exactly.
Our physicians think of themselves as advocates for their patients. That's what they think.
And Arpi Castanian.
Yeah, and Arpi too. But anybody who's, your whole day is spent advocating for that patient, usually for healthcare outcomes, but why not with respect to policy too? And so get to know your doctor. I know you may only spend a few minutes with them when you're getting your checkup or whatever, but get to know them and learn more about them and interact with them. They're happy to have that happen.
I think today, as we see from today on, everybody should be very cautious and to know more. And you know, thank God today everybody has internet access to, like, this is for the young people. And I have to say that a lot of young people watch my show.
Good.
And they call me and they want me to talk about different subjects because they have kids, they have parents, they want to know what's coming up. And with this Obamacare, everybody was like, okay, Arpi, what's going on?
Yeah.
Well, there's so much going on. That's why, you know, we're trying to educate them.
Right.
But it's time for everyone to understand what's coming up. And even with micro, this is something that people should get involved to understand. And like you said, it's the best relationship between a doctor, physician, and a patient. And my hats off to all the physicians and to you guys, the County Medical Association, doing a great job. And I also encourage a lot of our physicians, especially the young ones that come in because they go through me. I tell them, you have to join.
They have to join. They have to join. I mean,
the County Medical Association.
The next generation of leadership has to be there now, and I'm hoping that young physicians, whether they be Armenian or not, come and join the LA County Medical Association and get involved and demonstrate the leadership that I know that they can provide.
Well, LA today, we have the diversity, and I think everyone today is like, we're all the same. I think so many years ago it was like, there's Latino, Armenian, white. Today, we're all the same, so everybody gets along well together. And I have to say, Latinos and Armenians, I think we have the same culture. It's a cultural thing that,
Very similar, very similar. I mean, it's very
emotional.
Very emotional, very heartwarming, but also the care about the community. There's a touch to the community that I think the Latino community and the Armenian community have, and the Korean American community and the African American community. They want to be engaged in the community, and they should. And hopefully, in this most diverse place in human history, Los Angeles, we can figure it out. Because if we do, then we have hope for the rest of the world.
But one thing that I see with the Armenian community, at least, I think, some with Latinos, it's a lack of education. Not education, it's the information.
Information.
That's what our point here is, to educate our viewers, for them to understand more.
Exactly.
Because if you, from my background, when I see a white person, they know how to appeal, they know how to file a grievance, they know about their health care. But when it comes to Armenians and Latinos, it's different. Well, Rocky, I want to thank you again for being our guest, and I hope this is not the last time, because we need you again. And we'll probably talk more about what's going on with the LA County Medical Association. I want to thank you.
It's a real pleasure. Thank you.
Thank you. Սիրելի բարեկամներ, մենք կներեք, որ այսօր մեր շոուն մենք կատարեցինք անգլերենով, որովհետև շատ բառեր կային, որ իսկապես շատ դժվար էր, որ հայերենով թարգմանենք, բայց մեր մյուս շոուերի ընթացքում ես խոստանում եմ ձեզ, որ մենք համառոտ խոսենք այս մասին, եւ կարծում եմ, որ այսօր մեր վիուրներից մեծամասնությունը անգլերեն հասկանում են եւ կարող են բացատրեն իրենց մայրիկներին, հայրիկներին եւ բոլորին։ Շնորհակալություն, մեզ նորից փնտրեք նորալիքի եթերում։